The career I'm wanting to pursue is dental hygiene. So, I have always had a love for dental hygiene, and it's something that I have always wanted to pursue since I was little. Dental hygienists do a lot throughout their day, and it's more than just cleaning your teeth. It's really focusing on the patient and what their needs are, and how we can help benefit them. So, first, let's start off with how this love of teeth came about. So, when I was little, my father had always made sure I brushed my teeth and flossed my teeth every night and made sure that I had good hygiene and made sure to teach me what good hygiene means and the importance of it. And then when I got braces, I was taught like structure of the teeth and how it works and the importance of them, and just was really fascinated by teeth in general. So, dental hygienists do a lot throughout their day, and I have done tons and tons of research on this. And this past semester, I got the opportunity to shadow a dental hygienist that I go to and see what exactly they do and how exactly they do it and why they do it. So, the first thing that they do is they prepare everything for the patient. So, they have to disinfect their entire room, then they check their schedule for the day to inform themselves on the patient the patients that they're going to be seeing, because every patient has different needs and different concerns, and they just have to really learn their patient before they see them. Then the next thing that they do is check their files to see if there's any washes on teeth and if they need any x-rays because you get x-rays most of the time once a year. That's what insurance covers most of the time. And then the next step is grabbing the patient. So they go out and call the patient's name and guide them back into their room and get them settled in. And then they ask the patient if there's any new medical history, and this is the time that they'll take a blood pressure. And then if the patient has concerns, they write it down for the dentist to check later. And then after the blood pressure is done, this is also the time that they would get their x-rays done if they are in need of them. And then the dental hygienist will make sure that they are comfortable in their chair, because this is where they're going to be sitting for the next hour or so. Okay, and then the third step is cleaning the teeth. So the first process of the cleaning step is cleaning all the plaque off the surface of the teeth. And so that can be the surface of the teeth and the gums. So most of the time, if you have plaque on your teeth, you'll just scrape it off with something called a scaler. And there's different scalers for different sections of the mouth. Most of the time, dental hygienists just kind of pick and choose what they want to use. Then if there is plaque buildup in the gums, there's something called deep cleaning, which is a scaler with a water pick kind of connected that will shoot water up in the gums to flush out the gums in order to get all the plaque out, to let the gums heal naturally and get them back to normal and stop being so irritated and inflamed. Then the next step of cleaning is polishing the teeth. So the dentist or the hygienist will allow the patient to pick the flavor of the paste that they want to use on the patient. And so most of the time it's mint, but there's other flavors out there. And they will turn on the machine and make sure everything's functioning, and then they will clean the teeth within sections, and after every section they will rinse it out with water and suction the water out, and just do that with the whole mouth. And then they will do one big rinse at the end just to make sure they got all the polish out. And then after they finish polishing, they will floss to kind of like double check everything. And so they'll floss because if you floss, you most of the time can feel plaque in between the teeth. After flossing, they will grab the dentist, and the dentist will come in and check, and they'll fill the dentist in on everything that they need to know. And then once the dentist leaves, they will schedule the patient and schedule the patient's next appointment and get the patient's goodie bag and send them on their way. So I know so much about dental hygiene, and I just have a true passion for it, and I am so excited to one day become a dental hygienist so I can teach people how to properly take care of their teeth and the importance of good overall dental hygiene is.